Hello and welcome. Today we're diving into a really important topic that affects so many people but is so often misunderstood: chronic pelvic pain. We're going to uncover a hidden cause that, surprisingly, has absolutely nothing to do with muscle weakness, and we'll be guided by the incredible insights from Dr. Farzana Khan at the Women's Health Clinic.
So let's start with this question, because it might hit really close to home for some of you. You have that awful, burning, have-to-go-right-now feeling of a UTI. You rush to the doctor, but every single test comes back clean. It's incredibly frustrating, right? Well, as we're about to find out, that feeling is actually a classic sign of something else going on entirely.
So, to help us make sense of this really confusing issue, we need a guide, an expert who can cut through the noise. So let's meet the specialist whose work is the foundation for everything we're talking about today.
Our guide is Dr. Farzana Khan. Everything we're covering comes from her amazing work at the Women's Health Clinic. And just look at her dedication. We're talking over 20 years of medical experience, starting way back in 2003. She's been focused on women's health her entire career, and her expertise is so current that she's now training other top clinicians in the field.
And this quote right here, it really says it all about her philosophy. It's not about confusing medical jargon or telling you what to do. It's about helping you understand your own body so that you can be a true partner in your own healthcare. It's this patient-first approach that makes her work so powerful.
And that clear, straightforward approach is exactly what we need right now, because in this next section, we are going to completely tear down the single biggest myth there is about pelvic floor problems.
Okay, so the condition we're really talking about is called pelvic floor overactivity. You might also hear it called a hypertonic pelvic floor. All that means is that your pelvic muscles are basically stuck on. They are constantly clenched, super tight, and they've forgotten how to relax and let go.
Now this is the aha moment. This slide flips the whole script. For decades, the myth has been your muscles are weak, so the solution is to squeeze them tighter with Kegels. But the reality for so many people is the exact opposite. The muscles are overactive. The problem isn't a lack of strength, it's a lack of release. Your symptoms aren't from sagging, they're from muscles that are literally strangling everything in the pelvis. The solution isn't squeezing, it's relaxing.
And because these muscles are so central to, everything, the signs can show up in all kinds of ways. It could be pain with intimacy, or a dull, constant ache in your low back. Or maybe it's that super frustrating feeling of not being able to start peeing, or feeling like you never fully empty your bladder. It's this whole spectrum of symptoms, but they all come from that one root cause: too much tension.
Let's go back to where we started, that phantom UTI. This is such a huge clue. When those super tight pelvic floor muscles spasm around your urethra, they create that exact same burning and urgent feeling. It's a perfect imitation of an infection, but it's purely muscular. And that's why no amount of antibiotics is ever going to fix it. Only relaxing the muscle will.
And here's another big clue: the shy bladder. You know that feeling. You sit down to go and crickets. Nothing happens. You have to wait, maybe concentrate, or the stream starts and then stops again. That's happening because the sphincter muscle, which is part of the pelvic floor, is just too tight to get the signal to open up and let go.
You know, after hearing all this, especially when your tests keep coming back normal, it is so easy to start wondering, am I making this up? Is this all in my head? Let me be perfectly clear. The answer is no, absolutely not. This is a very real, physical condition, and it happens for very real reasons.
Your pelvic floor doesn't just tighten up for no reason. It's often guarding itself, protecting you from pain after a surgery or from a condition like endometriosis. For a lot of us, it's also where we physically hold our stress and anxiety. Even everyday habits like constantly sucking in your stomach or tucking your tailbone when you sit can do it. And here's the real irony. Over-exercising, as in doing way too many Kegels, can actually cause the very problem you're trying to prevent.
Okay, so we've really dug into the problem and what causes it. Now for the most important part, the hopeful part. Let's talk about the path to feeling better.
If you take away one thing today, let it be this. The goal of treatment is to release, not to squeeze. It is the most critical principle. Think about it. If your muscles are already in a painful knot, would you try to fix it by clenching them even harder? Of course not. Doing Kegels on an overactive pelvic floor is literally like pouring gasoline on a fire. It will only make things worse.
The best way to get relief is by tackling this from a few different angles. On one side, you have these powerful self-care tools you can do at home, like deep belly breathing and fixing your posture. And on the other side, you have specialist medical help. The absolute cornerstone here is a specialist pelvic health physiotherapist. They are trained to manually help your muscles release, and that's often combined with other therapies to manage the whole picture of pain and anxiety.
Okay, let's get really practical now. We're going to walk through a couple of things you can start doing based directly on clinical advice that can put you on that path to relief.
So this is the reverse Kegel, the exact opposite of a squeeze. Here's how you do it. First, picture your pelvic floor as an elevator. Now take a really deep breath that expands your belly, not your chest. And as you inhale, imagine that elevator going down, all the way down to the basement. You should feel a gentle release, a slight soft bulging outwards. That feeling, that is relaxation.
Here's another tip that is so simple, but it's a total game changer. So many of us sit all day in this slumped position with our tailbone tucked under us. This keeps the pelvic floor muscles in a shortened, tight position. The fix? Just untuck your tail. Sit up tall on those two knobby bones in your butt, your sit bones. That one little shift automatically lengthens the muscles and gives them a chance to finally relax.
All right, let's wrap this up with the most important points. First, pelvic pain is not always about weakness. A lot of the time, it's about muscles that are way too tight. Second, those weird symptoms like the phantom UTI or a shy bladder are huge clues. Third, and this is a big one, Kegels can actually make this specific condition worse. The real focus has to be on relaxation. And finally, the good news. Relief is absolutely possible with the right kind of help.
And that really brings us to the final question, a question for you. Now that you know the difference between a weak muscle and an overactive one, it really changes everything. So are you ready to change your approach? Are you ready to stop squeezing and finally start releasing?